All right. Good evening.
Good evening.
Dr. Riaz, it's nice to have you here with us.
Thank you.
So, Dr. Riaz is my dad's older brother. He is an accomplished physician. He is a general practitioner who's practiced medicine for nearly 40 years in countries like Saudi Arabia, Pakistan, and he was employed by banks. And through his bank, he even shared his work experience with the UN, the World Bank, Asian Development Bank on various best practices and shared knowledge with these prestigious organizations. So I've given a bit of an introduction, Dr. Riaz, but I'd love to hear your side of the story. What got you into medicine, and tell us about all the things that you've learned.
Okay, my name is Riaz Ghani. I graduated in Pakistan in 1983, and since then I've been practicing medicine. I was working in the hospitals for the last 10 years, and then I became a general practitioner. Had the opportunity to work in a bank in Jeddah, Saudi Arabia. And I came across, multidisciplinary patients in my practice itself. Just to tell you a short story, when my dad was alive, he wanted we are four brothers, and his desire and dream was one of his sons should become a doctor.
Oh, okay. I didn't know that.
So I chose, to go into medical school in Pakistan, and I graduated from there. I'm sure he must be a very happy man.
Oh, yeah. May he rest in peace. So, with general practice, you are dealing with a wide range of issues that families bring in. You're going to have issues amongst children, amongst women, amongst men. And here at BP Harmony, we are particularly interested in creating content that serves patients with bipolar disorder and other mental health illnesses. So my first question is going to be in the realm of medications that have to do with mental illness. I've in my blog written about categories of medications that are often given to bipolar patients, like antidepressants and others like mood stabilizers and antipsychotics. So in your experience as a general practitioner, and we're going to create content with psychiatrists as well, but what you've learned, someone who may not necessarily be a mental health patient, and they may be showing signs of maybe needing a referral to a psychiatrist, but maybe you're the frontline person who has to convince them that, hey, you should go see a psychiatrist. Tell us about this wild world of diagnosis and medications off of these three general categories.
Yeah, to start with, I do come across different kind of patients, like pediatrics. At times, I come across pediatric patients having ADHD or autistic, and then...
Which, by the way, are comorbidities with mental illness as well. Mental illness has, especially bipolar disorder, has ADHD, ADD, autism, heart disease, diabetes, addiction, substance abuse. So there's a lot of comorbidities, and in future sessions we will talk to you about those comorbidities. But yeah, as you were saying.
Yeah, and we do come across adult patients as well as senior citizens as well. And at times we take help of antidepressants, and at times with my follow-up patients, I do come across mood stabilizers and antipsychotics. So we have to be very careful as such. When I prescribe antidepressants, I do explain my patients that they should not be dependent on these antidepressants. Same goes for patients who have insomnia and anxiety. We do prescribe benzodiazepines, which are very dependent itself. So we do explain them that, if they are on any of these medications, my plan is to explain them to come out of it by tapering the medications itself.
So before we jump into tapering, when is a sure sign? And this is general advice. We always give the disclaimer to our viewers that this is us sharing content, sharing general knowledge, and any sort of advice about medication and prescriptions and dosages are the sole prerogative of your healthcare professional, and this is general content. So tell us about this class of antidepressants, and who are those patients that receive antidepressants?
Well, when we take history, examine the patient at times, they need support, they're having mood swing, and they're not interested in, the world itself. And they're having anxiety at times, insomnia. So we take help of antidepressants.
Okay.
And there are quite a number of medications which are common here.
And how do antidepressants work? So someone who's presenting things like anxiety, a lack of interest in doing things that they previously loved to do, and even things like insomnia, how does an antidepressant work?
There are different kinds of antidepressants, and they work on neurotransmitters of the brain, that is dopamine and serotonin. So at times we give, blocking the serotonin itself. So there are a group of antidepressants which work on serotonin itself. And there are medications which works on dopamine as well.
So antidepressants are less commonly prescribed for people that receive the bipolar disorder diagnosis. Can you tell us about the two that are most commonly prescribed, which are mood stabilizers and antipsychotics? I myself, when I went through it myself, I was placed on 2 antipsychotics and a mood stabilizer. I was put on Lamotrigine, Depakote, Risperidone, and then they also threw in clonazepam in the more acute phases. So I was never put on Lithium, which is a popular one as well. It's quite intense. But before we go into, can you just tell us about these general classes of medications given to mentally ill patients?
Well, for antipsychotics, as you mentioned, you were put on Risperidone. There's other medications like Zyprexa and Seroquel. And we also add mood stabilizers. And they are most commonly use lithium, but it has major side effects itself. So there are 2 types. One is typical, medication itself, and there's atypical as well.
Yeah.
And we also use anticonvulsants like valproate, Tegretol, Lamictal.
Yep.
Along with, as you mentioned, you were put on one of the benzodiazepines.
Yep.
Like Ativan, Valium.
Yep.
But per se itself, all these medications are very dependent itself.
Yeah. And when you say dependent, do you mean addictive or habit forming, that once you're on them, is it easy to come off, or is it impossible? It takes time?
Well, my advice is that whenever they are put on these medications, they should be under healthcare, providers' supervision, and they're the best judge when to start,
Right.
when to increase, when to decrease,
Right.
and seeing the response of the drugs itself.
Right.
They decide when to take them off the medications.
Right. So what I can say from the experience of receiving a bipolar disorder diagnosis is once you receive the diagnosis, a physician, based off of their experiences, their training, and their biases, is going to trial a bunch of medication on you. And once a certain cocktail of medications stabilize you, they say, okay, stay on this cocktail for a certain amount of time. And so sometimes they'll throw a mood stabilizer at you, an antipsychotic at you, a painkiller, anticonvulsant, sleep aid, antidepressant. And what I can say from an experiential point of view, that what I can say from an experiential point of view is that the side effects are very dramatic and very strong. Mood stabilizers felt like the volume in my brain had been turned down almost to zero, and it felt like I was very distant from everything that I was experiencing. And it just felt like I couldn't feel anything. Like it's in the word, stabilizes your mood, but almost to the point where it fixes you in this zero neutral mode where it's difficult to feel anything. And then with antipsychotics, what I noticed is that it helped quiet my very, very chaotic mind. And it also helped with sleep. But it came with the terrible side effect of constipation, of feeling anxiety. The strange side effects of an antipsychotic is anxiety in some cases, for it was in my case. So tell me about the process of putting someone on these medication, and what is it that we're trying, what is the goal when deciding to put someone on these medications? You've mentioned, putting them on and tapering them off, but I'm just coming from the perspective of the experience that it's quite unpleasant. So to try to understand, especially someone who is like, I don't ever want to get on these meds because I've heard such terrible things about them. So what do you have to say to that response, to that sentiment?
Yeah, I agree that at times it's pretty challenging, to explain the patients when they are already having mental sort of abnormalities itself, I mean, we need to take a proper history, and then we do the evaluation, and then we decide which medications are going to work for it. It's just not like giving one medicine and you're going to, get your response itself. It's a complex sort of medications. The medications are put on itself, and it needs a very close monitor. At times, you need hospitalization as well.
Yeah.
So depending upon the severity and the type of mental disorder, that is bipolar, or there's extreme mental disorder is schizophrenia itself.
Yep.
Yeah. So we need to decide as such, what kind of a patient is this and what medications we need to put on. It's not only medication itself; they need social support.
Yep.
And at times psychotherapy.
Yep.
And all this works itself,
Yep.
But it is very difficult for patients to come out of the medications. I've, with my experience, I've seen whenever we try to taper the medications, they get the symptoms of the relapse itself.
Yep.
So, at times it takes quite a long time itself. But if they have all this, like as I said, social support as well as the other, support itself.
Yeah.
So in time to come, they start responding.
Yeah, I mean, I'm really glad you mentioned that, because that's what I do at BP Harmony. I wrote a book called The 5 Pillars of Bipolar Disorder Recovery: sleep, nutrition, movement, mindfulness, and community. And this community being made up of a qualified physician, health professionals like therapists, like mental health coaches like myself, and then a community of people that are going through a shared experience of getting better together. So we do a lot of things to prevent relapse. We do a lot of things to provide knowledge like this to help people and families especially. You remember when I was going through mine and how important your voice was to help guide my family on how to deal with me when they didn't really understand what was going on. I wasn't acting like myself. They didn't have the knowledge. And so that's why I feel really strongly about democratizing this knowledge and putting it out there, so that when people do have that initial first mental health crisis, that they are prepared for it. So getting your knowledge and your insight from the doctor's perspective on their thought process on putting someone on medication is helpful. So let's switch our conversation now to tapering. Once I had become stable and I was on the medication, and I just did not want the rest of my life feeling the way that the medications made me feel. They made me feel dull. I couldn't concentrate as much. I couldn't read as much. I couldn't speak eloquently. And I just did not feel like socializing. So there were things that at some point, I wanted to talk to my physicians here in America, especially, and say, hey, I want to get off of these medicines. And unfortunately, the general attitude that I was faced with was that of fear, of scare tactics, like don't do it because there's a high chance of relapse. Don't do it. You're going to be much worse than you were before. And that just didn't sound right to me. And I started finding voices of integrative medicine psychiatrists, of people who were in a position like me and said, no, I was able to get off of medications completely. And so that's how I ended up writing my book. What I learned in my journey was that, well, food can have a big piece, can play a big part in the recovery process. Getting your 8 hours of sleep every night in a timely manner is, doing yoga, doing mindfulness and meditation helps to quiet the mind so that you no longer need the medication. Alternative medicines like acupuncture, and we'll have specialists talk about these various things. But right now, what I'd like to hear and what our audience would like to hear is practical steps on tapering. Because even though I was doing everything I was doing, the real big hurdle, and I say often, it's one of the most challenging things I've ever done, is come off of these medications. They are habit forming, and your brain and your body throws a tantrum when you are not taking them. I tried going cold turkey several times. I was just like, I'm enough with this, and I'm just going to stop Lamotrigine, Risperidone, everything all at once. And my symptoms just went through the roof, and I almost had another episode, but I went back on my medication. So I was Googling furiously and heard about this world of tapering. So I found very little resources online about tapering and very few clinics in the US that provide tapering guidance. So my question for you is, what is tapering? Maybe you can give us an example of tapering what you've done with a patient, and general advice on tapering strategies.
Yeah, I think the first and foremost thing is, we need to gradually reduce the dosage itself. And it's important in several situations and various diseases to prevent withdrawal. And depending upon, if it's antidepressants or antipsychotics, benzodiazepines itself, or we also come across with steroids where, not related with bipolar, but we come across with patients who have asthma and arthritis. We do give steroids, and we give them a short course and then we taper it.
Oh, so this is a method applied across
yes, and so does
medical disciplines.
Opioids when it's given for pain.
Yeah.
We need to be careful as well, that they don't get addicted to it itself.
Yeah. Yeah.
So coming to antipsychotics or mood stabilizers, we need to be very careful as such when we are gradually, reducing the dosage itself. We need to have one-to-one, consultation with the patients itself to see, and we take a history itself to look into what's going on itself, because their mind is not working normal. So we anticipate that, withdrawing the medications abruptly, you tend to have the withdrawals. So we give support.
And I can tell you what withdrawal feels like. It's uncomfortable. I did the tapering process, and it lasted for me, and everyone is different, but it was a period of discomfort for 2 weeks. I felt anxious, I felt restless, heart palpitations, and the way I combated it was being outside, doing some physical work, exercising to relieve that anxious energy that was leaving my body. And then even some disturbances with sleep. And I supplemented with magnesium, with reishi mushroom to help with the sleep. So one thing that I would do during that uncomfortable tapering process is to go extra on my supplements, extra on my yoga, extra on things like acupuncture to help with that discomfort of the body getting used to a different ratio of that drug. So I agree with you that, from an experiential point of view, that I tried cold turkey, going completely cut, versus going through the tapering method. So let's say, for example, you have a patient who's on 2 mg of Risperidone. Walk me through how you would get them to minimal dosage or zero. Everyone has their own desire. We at BP Harmony are not advocating that everyone should get off of medication. It's your choice. If you feel comfortable staying on medication for the rest of your life and you just want to minimize it, then think about tapering. But if you want to, like myself, you want to be off of medication completely one day, then tapering is the strategy, supplementing it with the 5 pillars of bipolar disorder recovery that we have at our website. So walk me through a typical path if a patient comes to you and says, Dr. Riaz, I'm on 2 mg of Risperidone and I'm ready to be off today.
Well, we advise the patient that they have to, go gradually with it. And we go with this 2 milligram. And then after a week, we'll tell them to reduce to 1.5 and stay on this for a week. And then the next week, we reduce another 0.5. So we bring them to 1 milligram for a week. And then the last, when we bring the patients to 0.5, we continue for a week, and then we put it on alternate days, and then we increase the days, and then monitoring the symptoms itself if, you're not getting the withdrawal itself.
So what if someone, like say you drop them to 1.5, and after a week you see that they're not doing well? Do you keep them on 1.5? Do you increase it back? Or do you let it wait a little bit longer?
Well, it depends upon the symptoms itself. If it's really severe, then we have to revert back to 2 milligram.
Yeah.
And if it's working fine, so with the support, itself, we start gradually tapering it, as I mentioned. But the most important thing is just, as you mentioned, not only medications you were relying on, there are a lot of other things that was helping you as such, as you mentioned, your yoga and your sleep pattern itself. And then also, doing some exercises, physical exercises.
Weights, nutrition.
Absolutely.
Yeah.
And at the same time, you were taking natural medicine or whatever.
Yeah. Yeah.
So that helps itself, but in our management itself for, bipolar disorder, we don't have a set of pattern where we could, explain the patient that they have to stay on the medications.
Yeah.
But we don't emphasize on the alternatives itself, So I guess with your experience, and you have already written a book as well.
Yeah.
So, we can look into it itself, and it will be a guidance for patients who experiences bipolar disorder.
Yeah, my intention with BP Harmony is to represent a middle ground between the allopathic and the, naturopathic or homeopathic or Eastern tradition medicines. I feel like there's a lot of either or. Either you take the medication from the pharmaceuticals or you go completely in the natural route. And my book sort of advocates for a middle ground that there's benefits in all pathways, and that the emphasis for the physician is to be concerned about the patient's well-being and to use as many tools as possible. And so even me at BP Harmony, I say there is a place for medication. When I was in my period of acute mania, I needed an antipsychotic. I needed mood stabilizers because I was not in my senses. And in order to prevent harm to myself and harm to others, that's an extreme measure that has to be taken. And then also just the unpleasant nature of depression, especially suicidal ideation. The medication is a necessary thing to prevent self-harm. Even in my own experience of tapering off of Lamotrigine, Depakote, Risperidone, I do agree that the tapering process is not linear. Sometimes when I went from 2 mg to 1 mg, it was fine. I was able to adjust to it very easily. When I went from 1 mg to 0.5, it was easy. But when I went from 0.5 to 0.25, it took me 6 months to get used to that. And for some reason, I don't really understand the biochemistry. It might be half-life or something, but my body needed a little bit, just a little bit. Otherwise, it would throw a huge tantrum. So once I finally, after 6 months or several months, made it to the 0.25 stage, I stayed on that and just did not say anything. I'm like, I'm going to be good in this stage for like a year, and then maybe I will attempt to get to 0.25. And so I mentioned this because sometimes when I was in 0.25 and I thought I finally made it to 0.25 and I was on it for maybe a week, I had to go back to 0.5. And I had to, number one, learn to be merciful with myself because my body was not ready. I wanted to be done in a month, but I was stuck with this medication for 2 years. I had to learn to be merciful with myself and know that my body was working really hard to get better, and to be patient and to hold on to the promise that things do get better and that I will be able to be drug-free one day and live fully again. And thankfully, I'm here today. I haven't had to take any medication for over 2 years now. And, it's all thanks to God that that's happened, and the love and support of my family. With the 0.25, once I got to that stage, and then I followed that final strategy of every other day, then twice a week, then once a week. And then finally, I went really hard on acupuncture, on breath work, on eating very healthy for 1 month. And that was the month in September 2022, something around that time. I said goodbye to psych medication. So what advice do you have for someone who is going to embark on the tapering journey? Just the ups and downs in the tapering journey. What, as a physician, someone who's probably dealing with someone who's struggling with the emotion of wanting to get off and feeling addicted and feeling stuck, what final piece of advice do you have for someone who is looking to get off of psych medications?
I think I should emphasize here that you have to be under the healthcare guidance. and supervision. This
Yeah.
is foremost.
Anytime I did it, I was always under the direct supervision of my psychiatrist. And at some point I had just memorized all of the answers that they would tell me. But I was always working under the guidance of a psychiatrist, and we advocate that at BP Harmony as well.
Yeah. And then also, as you mentioned, your family support was, very crucial itself.
Yeah.
And, they supported you all along.
Yeah.
And at the same time, as you said, yoga, nutrition, diet itself, physical workout. It's just not that simple, but you have to put in a lot of efforts in it.
Yeah.
And we as physicians, we emphasize more, that the patient, when we see that they are almost a year and a half on medications, there's a time that we want the patients to come out of it. And the best way is to, it's just not one way. The doctor gives, advice and the patients listen to it. There's always...
Compliance, I hear, is a notorious issue.
At times we come across patients who don't follow this, advice and the tapering guidance itself. So, I'll end here by saying that, tapering itself should be done under medical or healthcare, guidance and provision itself.
Awesome. Yeah, I agree with you that the community, my family played a huge role. Unfortunately, a lot of people don't have good relations with their family, and maybe they rely on their friends. A lot of people with mental illness are isolating themselves. They don't have any friends, and that's why I thought that it was important to create this online community where people, even in a discreet fashion, can connect with people, can talk about their struggles with medication, their victories, their wins. And so that's a huge offering that we make at BP Harmony, because a lot of us feel sometimes that the world doesn't get it, what we're going through. But when we find people who are going through a similar journey, it becomes cathartic, and it becomes a medicine in and of itself when we feel that someone gets it, and so we feel heard. And this is, demonstrated in psychology, that, just feeling that someone understands you does a lot to create internal peace and mental quietude. Well, thank you, Dr. Riaz, for this wonderful first session. We hope to have you in future sessions, and I always love picking your brain about health and, the allopathic tradition and how doctors go about their way of taking care of patients. So I appreciate you coming today. Thank you.
Thank you.